Hi, I'm Jamie Marbo with Inspired Hygiene. One of the very first activities that we do when we go into our private coaching client's office for the in-office visit is we do an exercise called the calibration piece. Basically, we get out the probes, we look at them, we make sure that everybody's calling a 3 at the same spot and 4 and so on. The other thing we do is we make sure that everybody is actually measuring pockets the same. Are they walking the probe around, or are they doing just a 6-point reading? We know that our patients can lose bone all the way around the whole circumference of the tooth. The other part is the angling into the call space. Some of us across the country were taught to always keep the probe parallel with the long axis of the tooth, and that's correct when you're on the direct buccal and lingual. But when you get to the call space, are we all measuring into the call space the same? So it's important that we get somebody from the office in the chair, an assistant or one of our team members, and we practice on each other. We get some feedback from our team member as to what the touch is like. Is there more pressure being applied than the other? Can we feel you probing but not have it hurt, which is important. We don't want to cause pain, but we also have to make sure that we're getting to the base of the attachment and getting to the base of that pocket. The last thing we calibrate on is the actual activity level of their disease, which is the bleeding. Lots of times, many of us don't get a lot of BOP, and there's a reason for that, because we're just going in and we're touching the attachment level. But the true bleeding sometimes will happen once we get our scalers or inserts or tips out, and the back side of our instrument starts touching the whole epithelium wall, and that's where the disease level is a better indicator. So we have to make sure that we're all having a consistent hygiene diagnosis for our patients. We don't want to have good cop, bad cop mentality, and it's just important that we're all calling disease what it really is and as consistent as possible. So get those probes out, get talking about it, and let's all be on the same page. Thanks, and make it a great day.